Millions of couples who have trouble getting pregnant turn to in vitro fertilization. And recent advancements are not only improving success rates, but giving hope to even more parents-to-be. And Dr. Robert Kaufmann is the medical director of infertility services at the Paul and Judy Andrews Women's Hospital at Baylor All Saints Medical Center at Fort Worth. And he joins us now. Hi, Dr. Kaufmann.
Hello, Amy.
This is a really interesting topic, and there are exciting advancements in your field right now, aren't there?
There sure are. Infertility is undergoing a number of changes, but probably the most exciting change is preimplantation genetic diagnosis, because that's just too long to say all the time. We abbreviate and just say PGD.
PGD. Okay, what exactly is PGD and how does it work?
Well, PGD is a technique where we're able to biopsy embryos and figure out where we have healthy embryos and prevent transmitting genetic diseases actually even before pregnancy. So what occurs is we form embryos in the lab through a process called in vitro fertilization.
Which we're familiar with that term.
Or IVF, right? That's the other term. Again, another abbreviation kind of helps us. And then what we do is we put egg and sperm together, we form embryos, and then what actually happens on the third day of development, we'll actually remove one cell from an embryo. And you can see that in this video here.
Wow.
I mean, it's pretty amazing, isn't it? And just imagine, this is microscopic. You can't see this with the naked eye. And here you're removing one cell from an embryo. And then what will happen after we remove this cell from the embryo, we'll do genetic diagnosis on that one little cell, and then determine which embryos are normal versus which ones aren't. Transfer just the healthy embryos back into the mom, and amazingly enough, there's no harm to these embryos. I actually was involved in preclinical pioneering studies establishing its safety.
Wow.
Pretty amazing, isn't it?
That is so amazing that you can remove that cell, like you said, something you can't even see with the naked eye, and then this is no harm to the embryo, but amazing advanced science going on here. How long has this procedure been around for?
About 2 weeks. No, it's been around for long.
Dr. Koff, you are snarky this morning, Dr. Koff, and I was going to believe you. 2 weeks.
I think it was the coffee. No, it's actually been around since the early 90s. There are probably over 15,000 cases already performed using this technology.
I would imagine those at advanced maternal age, maybe a history of cystic fibrosis, those would probably be good candidates, but I'm sure you could tell me more about that.
Exactly. I'd say probably the more common reasons I'll see patients with this, they'll come to see me, they'll have a child with a genetic disease, cystic fibrosis, sickle cell, and they'll go, you know what, we can't do this again.
Yeah, sure.
And so it's like, okay, well, we have a technology that can prevent that from occurring. The other areas where we're able to help couples would be couples that have repetitive pregnancy losses.
Right.
Sometimes they have genetic things going on, so we can actually analyze that, help them have a successful live birth.
Yeah.
And as you said, women of advanced maternal age or older patients that might be at higher risk for Down syndrome, we're able to offer this to decrease their risk of that occurring, again, before pregnancy.
Right, that seems so advanced to me, and I'm sure you have lots of great success stories from couples who have been patients of yours. What has been their feedback?
It's really amazing. I mean, it really is an honor and a privilege to help these couples. They see me, I'm sitting across with them just like this.
Right.
They're seeing me, they've had a child with a problem, they feel, you know, there's no way they're going to have a healthy child, and I can actually look at them in the eyes and say, you know what, we can help you with this. We'll be able to help you have a healthy baby, and really it just doesn't get any better than that.
Yeah, I mean, they've been suffering for so long, multiple miscarriages, like you said, or maybe they already have a child who's suffering from something, and you can give them new hope.
We do our best.
Which is so amazing. Dr. Kaufmann, thanks so much for being here today and sharing this great technology with us.
Thank you.
To get more information about genetic testing, please call Baylor at 1-800-4BAYLOR or visit BaylorHealth.com/AllSaintsWomen. Now we're going to check back outside with our